Health, safety, economy, education. We are hitting on all of it.
And we are taking your questions straight to the state decision makers who can help us beat coronavirus. Thanks for joining us. I'm Carrie Pena.
And I'm Ted Simons. Let's first introduce tonight's special guests here to provide answers and solutions during these uncertain and unprecedented times. Arizona Governor Doug Ducey, Dr. Cara Christ, Director of Arizona's Department of Health Services, Arizona National Guard Major General Michael McGuire, and Arizona Chief Operating Officer Daniel Ruiz.
And you will see that we are making a point to social distance here in the studio, no live audience, and plenty of space between us. Also note, we are offering closed captioning, and we partnered with the Department of Emergency Management to offer ASL interpreters. You can watch the interpretation at facebook.com/AZDEMA. And we've been combing through thousands of your viewer and listener questions, more than 5,000 questions, in fact, which we will be asking throughout the hour.
Let's start with Governor Ducey. Thank you. Good to see you. Thank you for being here. The numbers today, 1,600 cases. We have over 30 fatalities. Maricopa County hit the hardest. We see these numbers on a daily basis, and we look to these numbers for some sort of suggestion as to where we are and where we are going. How do we trust these numbers when so few people are being tested?
So let me first frame up where we are. I want to say thanks to the Arizona Broadcasting Association for giving this opportunity. I want to say thank you to the viewers at home who are staying at home, and by doing that they are slowing the spread of the coronavirus, and for that we're grateful. This has been a very tough month in Arizona, and my heart goes out to everyone who has been affected by this disease, and that's basically everyone, because no one is unaffected in our state. That's why we brought our senior team here, so we can share with everyone what we know and how we're making decisions. We're thinking with our head and we're thinking with our hearts. We're following the numbers and the data, which I'm going to talk about, but we also know that every decision that we make is affecting the people we love most, our parents and grandparents, our neighbors and loved ones. So I want to begin by just saying to everyone, if you don't have COVID-19, we don't want you to contract it, and it's avoidable. And what we talk about tonight will allow you to do that by making good personal decisions. If you do have COVID-19, or you're concerned that you've contracted COVID-19, you are top of mind. We want to make sure that you're going to have all the care and comfort that you need, along with support and information. That's why you're going to hear us talk a lot about supplies. You probably heard about PPE, that's personal professional equipment. That's the gloves and the gowns and the masks and the ventilators and everything that our heroes on the front lines, that's our doctors, our nurses, our emergency medical responders, are going to need so that they can help navigate through this. So a shout out to the Army Corps of Engineers that has parachuted into Arizona and will be able to build additional hospital capacity if that's necessary. And of course, I don't want to forget about our teachers right now. They are at home teaching over a computer, oftentimes removed from the reason that they entered the profession. And that's our kids who are home all day with moms and dads. And we're going to be able to get through this part of it, but to the National Guard who's shoring up our supply chain, and to the people that are working inside the grocery stores, restocking those shelves, because the next month or two in Arizona are going to be tough ones. So what we're going to do tonight is answer the questions that you have, be transparent. We said that we're going to over-communicate, and as an administration, we've got a plan, we've got a team, and I want to address the testing part of this. Testing is critical. Every morning, I start out with, of course, Cara Christ and a briefing on what's happening in health services. But I also get to visit with all the governors across the country. We have the White House video conference call. Everyone is focusing on doing as much testing as possible, making sure we have the real numbers in real time so we can prepare for what's ahead. We know that the virus is here. We know that it's spreading, and the idea is to reduce the spread and lower the curve. And I'm going to let the subject matter expert talk about the efficacy of the testing, but I'm confident that the numbers that we have to date are accurate, and we just need to get more.
Dr. Christ, are you confident, again, when the directive, as far as the toolbox that you referred to earlier, that if people even express and show some mild symptoms, they should not necessarily be tested? How do we work? Everything the governor just said has to be based on data and information. How do we know those kinds of things when people aren't being tested?
So my team and I have been focused on increasing the testing capacity across the state, and we have done that over the last few weeks. As a public health professional, I love data, and I want as much data as I can get. A couple of the tools that we have, we do have commercial labs that are testing. We've tested over 23,000 people in Arizona. So our numbers have increased significantly. And what we're trying to do is to get that farther. But we need to prioritize those tests for our frontline workers, our doctors, our high-risk individuals, and our first responders. So if somebody's just having mild symptoms, very similar to the flu, the treatment doesn't change. And so we would ask them to stay home, not expose our healthcare workers.
But are you including them as presumptive cases to get some kind of idea regarding the spread?
So we know that we're only seeing the tip of the iceberg, but this is how we do surveillance for a number of other diseases, just like flu. So with flu every year, we know that we are catching those that have gotten a positive lab and reported to public health, but we know that there's a lot that don't go to public health.
Governor, let me ask you, Arizona has been criticized for ranking near the bottom for testing. How are we catching up, and how do you respond to that criticism?
Well, first, I would say we need to ramp up our testing, and that's my expectation. We are at over 23,000 tests, so where we were a week ago when some of that was breaking news, we've been able to do more testing. And this is an issue in every state in the country. Like I said, I host a conference call. I just got off it and I was the moderator for governors from around the country. We're going to continue to ramp up the testing. And I talk to a lot of people, and I know that everyone wants a test. But we really have to prioritize these tests. We have to make sure that the people that are on the front line that are going to take care of the folks that contract this disease do not have it themselves. So doctors, nurses, healthcare professionals, those medical responders, the correctional officers that work inside our state prisons. And then it is people that are symptomatic, and the Department of Health Services is setting that criteria. I believe we'll be in a place where eventually everyone that wants a test will be able to get a test. Today we have to prioritize, and even if someone were to test positive today, the diagnosis is the same: to stay home, do not go outside, wash your hands, cover your cough, recover.
Is the issue that we don't have enough tests, or we are not able to process the tests?
The issue is we don't have enough tests. We are able to process the tests. Once we are able to acquire more tests, and these are, I have a lot of confidence in our American manufacturing supply chain, we'll be able to conduct more tests.
Governor, was it a mistake to not start testing sooner?
We did start testing sooner. If you remember, Ted, New York got hit first, and they got hit hard. Harder than anyone in the nation. And if you see what's going on in New York right now, Louisiana, and some of the other spots, that's where many of the tests have gone. We're at 23,000 tests in Arizona, and we'll continue to add more.
Dr. Christ, but could we have started what we are doing now earlier?
So we were one of the first public health labs to bring testing into our state. So it took a little bit for our commercial labs, which is normally how most people get tested for any type of medical condition, whether it's HIV. Those get done by the commercial labs. Our commercial labs came on relatively quickly, but with the issues with the supply chain to actually get the nose swabs, that's one of the barriers that we are encountering.
Governor, when you issued the stay-at-home order this week, you resisted that for a bit. What was the tipping point?
Well, every morning we look at where we are in terms of the risk to the state, the spread to the state, the number of counties and people that are affected. I'm not guessing on these decisions. I've been in alignment with the Department of Health Services and the Centers for Disease Control. So Dr. Cara Christ is an infectious disease epidemiologist. She led the state through H1N1, the Ebola outbreak, and the 2016 measles outbreak. We also do the video conference call with Dr. Anthony Fauci of the CDC and Dr. Deborah Birx. So we look to what the guidance is for Arizona. We're in a different position than every state. And my focus every day was to follow the guidance and make the best possible decisions for the state of Arizona, not with regard with what's going on in the news or what else is happening out there. We're going to be acting with a sense of urgency, but following the facts.
Governor, a lot of folks are curious as to why hair salons, nail salons are considered essential services, essential business.
First, let me talk about what we're trying to do here. We're trying to slow the spread of this virus, which is in every state in the country. The best way to do that is to break up large gatherings. Okay, so that's where we began. We started by canceling school. After that, we shut down restaurants and bars and nightclubs. And I want to say, just as a side note, after the show is over, I hope people will order takeout or delivery. After that, gymnasiums and health clubs and movie theaters have all been shut down. Spring training was canceled. There was no March Madness or opening day. There's no professional sports, there's no college sports, there's no high school sports. Right now there are no gatherings where people can meet in large groups. That's the CDC guidance on how to slow the spread. Now, if there are other things we need to do in addition to that to bring clarity, and the businesses you're talking about are not covered inside our executive order. If they're looking for cover under one of the categories, then they're going to have to be able to demonstrate that they can exercise social distancing or some other type of protective measure.
But how does a nail salon or someone who is styling hair or someone working on, how in the world do they keep the recommended social distancing?
Yeah, and what I said is we focus on shutting down as much as we could of these issues to slow that spread. If there's additional guidance that's necessary, because those services are not covered under the order.
Do you understand, though, why people are confused?
I understand completely.
I want to follow up with a few viewer questions. As we mentioned off the top, we do have more than 5,000, so I want to try to move through these as the hour progresses. Allison Jenkins from Tucson asked you directly, Governor, please answer, why are salons, nail shops, and barber shops still considered essential services? It seems like an unnecessary risk for clients and beauticians, and it is not essential. And then one other question, if I could, from Aurelia Bradley in Chandler. Why is the list of essential businesses in Arizona so much larger than many other states? If you could answer both of those viewers.
Sure. So we took the guidance from what we saw as best practices in other states to add to Arizona. And like I said, the businesses that are being mentioned here are not inside the order. What they're taking is some part of the order, and they're behind that. If we need to update the guidance, we will do that, and we'll continue to do that. This is changing on a daily basis. We've increased the guidance along the way, and it seems like we need some clarity around these issues, because if people aren't practicing the physical distance, if they aren't using protective measures that are non-surgical, then they're out of compliance.